Health matters now. The Niger State Ministry of Health has recorded improvement in maternal and child health with a 90% success rate in child survival after birth. The Commissioner for Health disclosed these at the opening of a neonatal intensive care unit at the Jumaiba Bangida Aliyu Maternal and Neonatal Hospital in Minna. Chinemi Beme reports.
Health is a key indicator of a society's level of development, in addition to its healthcare delivery performance. One of the major setbacks of poor healthcare delivery is infant mortality, which revolves around primary healthcare inadequacies, largely attributed to poverty and the absence of efficient neonatal care facilities. Ineffective anti- and post-maternal healthcare are decade-old concerns that have stalled quality healthcare delivery and has reduced the survival rate of infants at birth. The Niger State government, through its Ministry of Health, partnered with the Nigerian expert and professor of medical engineering technology from Imperial College of London, United Kingdom, Professor Hippolyte Amadi, in designing and installing custom-made machines to upgrade the neonatal care unit in the General Hospital.
During our peak months, we see 800 or more every single month, and all the doctors and nurses here have received special training. This is not just their training from their universities. This is post-graduation training tailored to newborn care in this kind of climate and part of the world. So they are very specific, and that's why they are quite successful.
Equipment now available at the neonatal unit include radiant warmer, resuscitation machines, incubators, phototherapy machines, oxygen concentrators, polite heart oxygen, transport incubators, which are also used outside the hospital and sometimes rented outside the state, errand incubators, invasive and non-invasive ventilators, power station to ensure a steady power supply, and Firefly for the treatment of jaundice in babies within 48 hours, among others. But the major challenge that government facilities like these have always faced is inadequate maintenance and sustainability. Dr. Mohammed Makunsidi is the Commissioner for Health in Niger State. He says staff of the units have been well trained to handle the machines to also fix faults in the absence of the consultants.
We train our staff, both clinical and mechanical, in terms of maintenance, to see that at the exit of prof in our contract, we should be able to sustain ourselves, and even after the exit of this government.
Wife of the Niger State Governor, Dr. Amina Abubakar Bello, who is also a gynecologist, commended the effort of the state government, noting that the present improvement in neonatal healthcare facilities in Niger State constitutes the foundation for future child, family and overall development.
Now, Niger State happens to be one of the states that has a high mortality, maternal and child mortality. But I can tell you that from at least with statistics that we have here with the neonatal unit, there's a significant reduction in neonatal and child death. The same thing also with maternal health. So a lot of things have been done so far. One of the most important things I think I want to mention is the revitalization of the primary healthcare centers to having 274 focal units that could provide 24-hour service, which ensures that women who happen to go into labor in the evening, in the night, get care. And that's one of the things that those are some of the things that allow our women to have safe deliveries and reduce maternal mortality. There are very few centers in Nigeria that have the equipment and the kind of work that has gone on in this facility in the last 3-4 years.
Comfortable services, and they attended to our children very good and fine. And we have no any much problem about infants again, because since these places being developed, we didn't have so much problem when our infants are sick or having any other problem.
It's just for Zazabi Kawai.
There's been no problem. It's just the fever and rise in body temperature. But since we arrived and started receiving treatment, thank God, the boy is now recovering and there is no problem now.
With this upgrade, infant mortality and inability of pregnant women to access healthcare has been reduced. At the opening of this intensive care unit here at the Jumai Babangida Hospital,
We came across this baby that was born without eyes and genitals, and it's one of the issues that will be addressed in this place, even though not completely, but this will provide some form of arrangement for this baby to be taken care of. Chaneme Bami, TVC News, Minna.